Good afternoon, everyone. Thank you for joining us. Today, we are joined by Rob Bloom and Rich Duvall, the CEO of North Star Health Alliance. They will be presenting on kind of follow up to our previous session of benefits, but specifically at this session, we'll be looking at a case study on recruitment and retention. We are a smaller group on this live webinar, so if you have any questions or comments or concerns, please feel free. You can take yourself off of mute, or if you want to put something in the chat, I'll be watching the chat. If you're watching this recording and you have any questions or concerns, please do not hesitate to reach out. And with that said, Rob, I'll turn it over to you.
All right. Well, thank you very much, Laura. So really, this is a lot of the information we've discussed in the past. But, the one change we have today is I have Rich Duvall joining me, and he has implemented a lot of the things we're talking about. And in fact, the case study is with regard to one of his hospitals. And so, we're really approaching this from the angle of, strategic planning and trying to deal with a lot of our recruitment and retention challenges. So, as I think everyone knows, right, recruitment and retention are not easy. We have a lot of different pressures converging upon us, right? It's obviously, salary and benefits are the largest expense on almost every hospital's income statement. We know we have a significant shortage of physicians serving the rural 20% of the country. And really trying to manage labor costs continues to be a challenge, especially when we think about, some of those other pressures we're facing, such as expansion of, the MA plans into our markets, which ultimately is eroding some of our margin. And so it's a place that, a lot of hospitals struggle, but rural in particular. And, one of the things that, when I'm doing a strategic planning event with a hospital, rural, we wear a lot of hats and we wear that as a badge of honor. But if we pick at that a little bit, what it really means is that, we have oftentimes vacant positions, and that means tasks are not getting accomplished under optimal conditions. If we start getting into things such as healthcare, we're seeing more and more of that cost being passed on to employees. And that's certainly an area where, there's been new competition trying to approach that a little bit differently, which means we also need to rethink how we're approaching that. And, when we start thinking about benchmarking, most of us tend to benchmark ourselves to what we consider peer hospitals, those that are kind of within our geographic area. But, one of the challenges that I think that creates is oftentimes what we're really doing is, saying we're as good, but not garnering any sort of competitive edge over those peers when we're, basically all trying to hit the same numbers. So, really what I'm suggesting here is we need to spend some time reevaluating our current employee benefit packages and making changes that are necessary in order for us to be competitive in the market so that we can recruit those high quality employees that we need to ultimately drive operations and retain those employees that we currently have, because we know people are getting a lot more mobile than we've seen in the past. So I'll turn it over to Rich here to, kind of talk a little bit about his perspective on, approaching people and how he's thought about that within his hospital system.
Thank you, Rob, and thank you all for inviting us to present today. I think Rob hit a number of the things in his opening comments, and what we're experiencing here in very, very northern New York. In fact, I joke sometimes and say we can throw a snowball to Canada because we're literally right across the river from Canada, is a number of different challenges. And I think we're all facing those recruitment challenges, whether it be due to shortages of certain professionals or the fact that people are just burnt out and exiting the field. The other thing that we've have experienced over the last several years is the entrance of new competitors. So people actually recruiting some of our specialists, if you will, to work remotely across the country, or to be able to offer a position that maybe they're only on site 1 week a month or something along those lines. Also, there's the obvious truth of the changing workforce and the different generations that are motivated by different things. And then we're all restrained by how much money we have to be able to create a program that's attractive and able to recruit and or retain new talent. I think quite often we get into a situation that we're just checking the box and we don't think outside of the box to really talk with our employees and say, what is it that's important to you? And then how can we build that to both increase retention and also have a positive effect on recruitment?
So I mentioned earlier, I think a lot of times, what we find is successful people lead to successful organizations. And there are, a number of things that ultimately, drive our ability to recruit people. Compensation is probably the easiest thing to think about. But, one of the things that, I'm often forced to remind people of is that, cost control is not necessarily an effective strategy for people. So if we want to attract and retain top talent, we're going to have industry leading compensation packages. We're, of course, at the same time going to have to make sure that we're driving performance to cover the costs of that. But our initial approach to it shouldn't be how cheaply can I retain that person. It really needs to be focused on what operational outcome are we seeking to get. Personal fulfillment's another one. And this is a place where I think, employee benefit plans can play a role here and be structured in a way that, ultimately maximizes employee value, not necessarily meaning that it's going to minimize cost or administrative effort. And then we think about, operational excellence. Top tier employees are required to optimize our operational results. And so if we really want to make our focus on overall organizational efficiency, we're going to need those people that will drive those results through our organization. Otherwise, we're just going to continue to struggle. And then, the last piece of the puzzle here, I think, is, actually building this into our strategic plan. And so I can probably count on one hand and not need all of my fingers to count the number of times that I've actually seen organizations effectively build an HR strategy into their strategic plan. It tends to be something that rarely gets talked about. And if it does, it's what I would call primarily lip service, right? We're talking about it at a very high level. And we're really not spending the time to figure out, okay, what do we need to really change? How are we going to measure it? And, what are the expectations that plan is going to drive through the rest of the strategic plan? And I think that's just, a big miss that ultimately we're seeing happen on a recurring basis. So, when we think about what's it going to take to really build a winning team, I always like to try to first, define the problem that I'm trying to solve. And, one of the things I think, that I would say is, I think that recruiting and retention are ongoing challenges in rural settings, but I think we can address them through strategy. Part of this is taking the time to kind of really, give ourselves a good look in the mirror and try to figure out where have we not been successful in the past and why. So if I think about, my overall experience with rural organizations across the country, I can say one, we still tend to exist in our own little microcosms and oftentimes believe that we're competing only within the local market. If we start thinking about things like healthcare benefits, I think we tend to view them as a necessary and expensive evil. I mentioned on the previous slide, compensation structure rarely becomes a part of overall strategic planning. Our offerings are what I like to call, pretty vanilla, meaning, there's not a lot of variation. If you look at compensation plans amongst, a group of hospitals, they're fairly comparative across competitors. And I think there's also this belief that benefits don't drive recruiting efforts, salaries do. There's probably some level of truth to that, particularly, through COVID and immediately following the pandemic. But, we're starting to see now that for those that are able to, start trying to make changes. And certainly one of our goals should be the bidding, because we all our competitors, we are not ultimately going to win that race. So, why don't we change? It's one thing to say, hey, we need to change. We need to make those changes. And that has been, very, very difficult. I think there's a number of things that are also creating. They tend to invest in obviously what I've put in quotes there, education. And the reason I word it that way is, I've participated in and sat through, say, a number of RFPs for, say, a benefit plan. The interesting thing that I've seen happen more often than not is no matter who was retained to help lead that and hopefully make sure we can check all of those compliance blocks. A very high percentage of the time, those what we thought were going to come in as independent third parties also just happen to have some sister organization that does an employee benefit platform. And amazingly, they appear to be the most cost effective about 80% of the time. And so, when you see that enough times, you start to scratch your head and say, I wonder if there's something to that. I think, those things have maybe led us astray, and we've not spent the time that we need to really sort of pick apart how we should be thinking about that. And then I think, again, as I mentioned, we compare ourselves to what we define as our competition to evaluate parity versus saying, what could I do to make us completely uncomparable and the obvious choice? Then we get into some of the HR theory that's taught by various professional organizations. And we forget that most of them don't operate healthcare facilities and may not know some of the unique advantages that we can bring to bear. And finally, and potentially the most concerning one is, sometimes there's just lack of effort put into it because, we're busy working on 5,000 other fires that we have deemed more important. That really, at the end of the day, is just perpetuating our challenge as we move forward.
I think the big part behind the strategy is making sure that you spend a lot of time communicating with all stakeholders within your organization. Also, I think it's important to leverage expertise, and I think also understanding you may not have that expertise within your organization, and maybe you need to seek that out as you start looking at rebuilding these things. I think collectively, our experience of working with outside experts, also listening to our employees, surveying what other industries are doing, has allowed us to come to solutions through joint problem solving. Also, I think innovation is key here, understanding that sometimes what you're seeking to do may not exist, and that's hard to leverage or to think about or to push forward unless you can really utilize, that outside of the box thinking to put together a plan that's meaningful to your organization, to your people, and create that innovation to attract the highest level people that you can for your organization.
So, just kind of a quick note here on some benchmarks before we move on. Again, one of the things I think that has been a challenge was certainly a challenge for myself as a CFO. Oftentimes we don't even know what some of the benchmarks are. And so, we kind of put some of these out here in terms of, how do we evaluate whether or not, the platforms that we have could be considered, overall attractive? And, what we kind of found is, as we worked with a number of organizations that are service providers for those various benefit plans, is, a pretty good rule of thumb is somewhere around 70% to be considered competitive. And I think a lot of times, we may not always approach this from the right frame of mind. I know that, early in my tenure as a hospital CFO, I used to think the best thing in the world is if we had employees who were on somebody else's health plan. I mean, who doesn't like other people's money more? It took me a while to realize that probably actually meant that we did not have the most competitive platform out there. And that's something that, we really needed to work on. The same is true of your defined contribution plan. If you find that your participation level is fairly low, it probably means that it's really not all that competitive. And most employees aren't really considering that part of their thought process when they're deciding whether or not to come work for you, as evidenced by the fact that they're not participating when they do. So, really, kind of doing an honest assessment of how we're thinking about those things and, how we want to position ourselves in the market strategically, I think is key when we're putting together our plan. So diving a little bit into, the case study. So we reviewed, one of Rich's hospital, which, was an issue that had come up, a number of years ago. And I think everybody's probably familiar with this story, which is, they were on a fully insured platform, several years of double-digit increases in premium, until the point it really forced, a thorough evaluation of, what needed to be done to move forward. And so because this has been in place for a number of years now, we decided, hey, let's really evaluate, not only what those initial savings were, but, what did that trend forward over the course of a number of years? And then also, in conversation, what is it that they were able to do with those savings to put them to work for the organization to help improve, the overall position in the market? And so, we're going to talk a little bit here about, the dollars side of this, but then, there are a lot of qualitative things that can also, come out of these things. So, for instance, staff satisfaction. In the healthcare setting, a self-insurance model lends itself very well to the establishment of a domestic network to allow employees to have little to no out-of-pocket exposure. It becomes a useful market research tool to the extent that we get to see some de-identified employee claims. We can start to evaluate our own service line gaps because that self-insurance model inherently is a feed of data for the services that are lacking in the facility in terms of when are our employees going outwardly. And, if you stop and think about the number of people and positions we employ within our hospital setting, it's actually a pretty representative cross-section of our overall community. And so when we start to look at those things, it can help us make strategic decisions around what service lines does it look like there's significant demand for that might make sense for us to bring in-house. It also gives us a sense in terms of how much we're spending on our own platform, how much money we already have to invest in it. So, if you think about something like, say, general surgery, we can look at it and say, wow, we're paying other organizations, we'll pick a number, $300,000 a year to provide general surgery to our employees and their beneficiaries. Well, then that really means we have pretty close to $300,000 a year to start up our own practice, which really reduces, some of the time it's going to take to have that actually become a break-even prospect for us. And the other thing is that you get with, going to a self-insured model is you get a lot more cash flow control than you have on a fully insured platform. So, on the quantitative side, we look at this on sort of an adjusted basis. So we adjusted the FTEs because obviously in this particular scenario, there had been significant growth. And so we wanted to adjust for that so that we weren't looking at just pure dollars, but actually sort of growth adjusted dollars. And so, we looked at the savings and we had a number of years here in this case study, 2021 through, the assumption on 2025. And so we knew the exact dollars for the 2021 renewal for the platform that had previously been in place on the fully insured side. And then we worked with Brett Shippey, whom you've all met at UPB, to look at the median cost increase for those fully insured platforms in the central New York corridor to trend that cost forward to establish what would it look like if it had remained on the fully insured platform. And then, as I previously mentioned, we adjusted the FTE levels to eliminate bias that was just caused by, pure growth in the size of the organization. And for 2025, because of course we don't actually know what that year's self-insured cost will be, we assumed it at the maximum potential liability. And again, we'll amend this once we have those results, early next year, so that we can see. But again, as you can see here, when we look at if the hospital had stayed on the fully insured platform, what those rate increases would have been, over those years, and those are just, unsustainable increases in the rate. So, when we look at, how all of the savings work, so in 2021 on the fully insured cost was going to be, about $1.9 million. And you can see how that trends forward to, in 2025, this would have been, up to a $3.8 million cost, which is just, tremendous increase in the exposure. And again, if you look at the self-insured side, there has been a significant reduction in that overall trend. Now you can see there was a blip that occurred there in 2022. That was related to a change in the pharmacy benefit management organization. And that sort of highlights the importance of actively managing these things as we're moving forward. But what you can see is, generally speaking, your organization has been saving, early on around $1 million a year and now well in excess of that. And, just sort of the way this one in particular was structured, assuming, they're able to have 2025 end in a positive way, there will be an additional savings of $550,000 moving forward, just due to some reduced costs of the trust that was joined. And we'll talk a little bit about that here in a couple of slides. So, I'll turn it over to Rich to kind of talk about, how he's taken some of those significant dollars and reinvested them into the workforce to try and change, his competitive environment.
I think another important point, which Rob had mentioned earlier, is our board and our administration adopted this as a distinct strategy in our strategic plan moving forward. And that was simply to become the employer of choice. And we went through a number of areas that we needed to work on to do that, with one of the major focuses being recruitment and retention and our benefits plan. I think with this restructuring of our plan, we have been able to achieve tremendous savings. And then you take those dollars and reinvest them across kind of the spectrum of the organization. And what we've used the specific savings for health insurance for is other benefits, such as increasing the amount of time off. Also, market rate wage increases. Also working on a very innovative retirement platform for our managers and providers, and hopefully are looking at rolling that out to our employees at zero cost to them, all funded by the savings realized from our health insurance platform. And this year, what I'm incredibly proud of is we started, as Rob highlighted back in the 2021 timeframe, our goal was to get to a point that all of our employees were not paying for health insurance. And this year is our first year of actually being able to roll that out. So in addition to those other things, from wage increases to time off to retirement plan, in 2025, the employees no longer pay a premium for health insurance. They do have a small contribution on the deductible side, but that has been a huge tool for us this year in recruiting. In fact, this year we're on track to recruit 17 new providers across the system, the majority of which were very impressed with the fact that there was no health insurance premium. And those things are funded by the savings we've been able to create. So this has been very lucrative and an absolute strategy for us that we're committed to continuing.
So really, when you stop to think about this, we're just trying to make sure we can keep a bigger bite of the pie. So, if we look at this case study, right, we've seen there's a pretty good opportunity to save some, pretty significant dollars, and as I've, worked with Brett on a number of these, we've sort of narrowed that corridor down for critical access hospitals to being somewhere between 30 and 45%. And that variation is ultimately driven by hospital capabilities. And just general, scope of services. So there really isn't a critical access hospital that meets conditions of participation that should ever fall below the 30%. But again, not all hospitals have the same number of specialties. But we can really, start thinking about this as just not sending checks to other people and being able to invest it into our own organization. And it's a function of, what the current plan structure and strategy is, the level of active management, and ultimately the amount of utilization that you see of the domestic network. And the other interesting thing is, when we start pulling these things together, most of the time the employees actually receive a better overall benefit. So as Rich mentioned, for his employees, they no longer have to pay a premium towards the health insurance. If they receive their services at one of the two hospitals or any of the associated physician practices within the system, there's no out-of-pocket exposure. So the only time they're going to have exposure to that deductible is if they have to go elsewhere for services that either they choose to seek elsewhere or are not available in the system. And, the same is really true of, a number of our other areas that we should be taking a look at, right? Yeah, it doesn't matter if you're talking about, what are the carrying costs of your 401k plan. Every area we look at, we should be trying to reinvest other dollars. Rich mentioned, one of the innovative retirement benefits that they've put into place. That also has some reductions in payroll tax liability for both the employer and the employee. Again, with the overall focus being on creating value. And, we start, trying to graph this out a little bit, based on those, tiers from, say, 30 to 45%, so that we can understand, well, what does this really mean in terms of savings? Well, if you have a $1 million annual spend on health insurance, you can see, you're going to be having an opportunity to save, if you're towards the 45%, approaching $500,000, meaning you can almost cut it in half. And you can sort of see how they cascade from there, depending on the size of the hospital. But again, this is one of those things that I think we really need to spend a lot of time making a part of our strategy and trying to develop out, what would those reinvestment opportunities for those funds be? Is it offering more time off? Because of course that has a carrying cost to it. Is it improving the retirement opportunities for the employees? And that can vary by hospital. So perhaps, right, if you're a municipal hospital with access to a pretty good defined benefit pension, you may not have to reinvest those dollars as much into retirement. Maybe it's time off. It's really all trying to adjust to what your organization has in its tool chest and figuring out how you can get there. Conversely, if you happen to be a hospital that is neighbored by municipal hospitals and their retirement benefit has been an advantage for them, then maybe you want to put some of those dollars into your own retirement platform so that you can regain some of that competitive edge. So it's really trying to figure out how we do this. So, on the health insurance side, and the reason we spend so much time focusing here is because it's really the only place that you have the tremendous dollars that can be saved and reinvested to create other meaningful platforms. So, if you think about, when you're fully insured, it's just a fixed premium, what the dollar values are. On the self-insured side, really what you're looking at is, a combination of what you're going to fund, what you're going to pay a reinsurer, also known as your stop loss. And then, ultimately, what you're able to keep domestically is what's going to drive a lot of those down. And so, when you kind of look at it, for most critical access hospitals, about 56% of the total spend can be impacted by our capabilities. And I like to remind everybody, we spend a lot of time in rural, particularly in the critical access setting, talking about the fact that we don't have the efficiencies of many of our larger urban counterparts. It's the reason that we have the cost-based reimbursement basis as critical access hospitals. So let's take that knowledge and apply it. Because really what we're saying is that means by definition we have excess capacity. And so because we have excess capacity, it is not going to cost us anything other than the very minimal variable costs of a visit to take care of one of our employees or their beneficiaries. So, if you stop and think about it, right? If we're talking about, an ACO, we want to, reduce potentially avoidable ER visits. If we're talking about a self-insured health insurance plan, we really don't care if our employees use our ER as an urgent care, because let's face it, we were going to have the doors open, lights on, staff there. So there's really very limited cost that goes into taking care of one of our employees. There's just not a lot, even if we have to, do imaging studies, right? It's a little bit of electricity, maybe some contrast, but certainly nothing relative to what we would have to pay another organization to provide those services for our employees. The other, common misconception is, we think about this from a risk management standpoint. And I've had a lot of conversations with hospitals that are, very uncomfortable with the potential risk, because we all know in a self-insured plan, there are going to be bad years. But that's why, it makes sense to put it together in a way where, we can, buy stop loss as part of a buying group, no different than, the GPOs we all participate in for supplies and services. Gives us a better buy there, puts us into a larger risk pool. But also bear in mind that at the end of the day, the insurance companies are not taking losses on our claims. Now, they will tell us from time to time, right? Oh, last year was very expensive. We've really got to relook at your rates, pass on those costs to you. Because remember, they're just recovering their prior year losses in your future year premium. So you've not really transferred the risk onto the insurance company. You're ultimately still always going to pay for it. So, I think that's kind of, one of the key pieces to latch onto is when you're evaluating your risk management strategy around this, be very honest with yourself about how much risk you're really transferring. And there are a number of ways, right? When we start, putting these things together, and many of these are things that Rich has set up that we can do to help manage our overall risk in these, right? So, the first thing, of course, was the domestic network, but and all that is giving the employees the incentive. So again, that's the no out of pocket if they receive their services at the local sponsoring organization, and then implementing steerage programs to really push employees to do that. That includes education, making sure everyone understands, making sure we get all of the simple things right. One of my favorite examples is we if we stand one of these up, we can also take some of the administrative burden away from at least our own employees and their beneficiaries. So think about something, that normally might require a prior authorization. Well, to the extent that, taking money out of our left pocket and putting it in our right pocket is not a part-time job, let's just, sort of reach the conclusion very early. It doesn't matter if our employees are on our platform, and if they're coming to see us, we don't need to get a prior auth on that because we were never making any money on it anyway. One of the other ones is implementing a wellness program, right? That's how we can start targeting issues we might see trending. That is going to require some effort on the hospital side to set up that committee. Make sure that the right people are at the table to evaluate, any sort of things that might be popping up on the radar as an exposure for us, and allowing us to take proactive action. And then, of course, requiring employees to participate in that wellness program if they want to not have the obligation to pay a premium. And then finally, the reinsurance, right? And we can adjust that both in terms of, where it's set for each individual contract or employee, and then what the maximum liability we could ever face globally. And that's one of the places, again, I mentioned, there are opportunities out there in the market to buy into risk pools, meaning you're pooled with a large number of employers, and the thing that, will really differentiate this from a captive is you have no capital buy-in. So, very similar outcomes without the capital buy-in requirement. So happy to open it up to any questions, and certainly encourage you all to take advantage of Rich's presence here as he's kind of, been through it, got the battle scars.
Hi, Rich. What was your biggest unexpected hurdle that you faced?
I would think, I think the pleasant surprise has been the number of employees committed and or interested in working on this wellness committee, and also the overwhelming support of us doing something different and recognizing their requests, or the employees interested in reducing their cost, and kind of recognizing some of the things that they raised up, and the fact that the board took note and made this part of the strategic plan. So I would say a number of very good surprises. And really, I can't think of too many negatives, to be honest with you.
Brooke made a comment in the chat that she does not have a question, but this is great information, and they're getting ready to switch to self-funded. Along with those lines, how long was the process from talking about it to full implementation?
It took about a year and a half. I would say somewhere between 12 and 18 months to really get it perfected. However, there was probably a solid 6-8 months of planning and research before we actually launched it.
Thank you. Are there any other questions? Well, I'm not seeing any come through. Thank you both for your time today. Thank you, Rich, for joining us and giving us some hands-on experience. I'll ask one more time if there's any questions. All right. Well, if you're watching this recording or if you're on this call and you have a question afterwards, please do not hesitate to reach out. Rich and Rob, thank you again for your time today, and everyone have a great rest of your day.
Thank you.
All right. Thanks a lot, Laura.